Hello, everybody. Let's all take a minute and think about the time that we walked into the emergency room and we are waiting longer than we anticipated. You walked in and the employees tell you we'll get you back here and seen as soon as possible. But then that as soon as possible turns into a 4 to 5 hour wait. We've all experienced that. And as stated in an article that I read by Monroe in 2015, you are being assessed the second that you walk into the emergency room. Medical employees have assessed your emergency, and they quote this word and come up with the conclusion that your emergency is not as an emergency as you thought it was. So if you're not hemorrhaging or if you're not having heart complications, you are not having a cardiac arrest, so you're not one of the patients that needs to be seen right away. So, what are the reasons that they come about these conclusions? Why is that okay? Why is it okay for the medical staff to decide that your emergency isn't as urgent as the next person's emergency? In healthcare, nursing is a very popular field, and it is expected to grow. Actually, in an article that I read, it is expected to grow from 2.7 million in 2014 to 3.2 million in 2024. That is an increase of 16%. So why is it so hard to be seen right away when you go into these facilities? With the baby boomers aging out, there's a lot of openings in the nursing field, and employees are looking for loyalty in these fields. So when they are interviewing and they're talking to these organizations, they are trying to find someone who's dedicated to the things that they are looking for, who's going to help them grow as a person, who's going to help them grow within their career, who's going to help them climb the ladder to the next position. And if these organizations are able to provide that, then they move on to the next place, leaving these organizations understaffed. So nurses working understaffed causes nurses to become overworked and burnt out. Because if these nurses are being burnt out, there's patients being hurt by this. As in an article by Budakoi in 2017 states, the study done in an RN network identified some key factors that contribute to a lack of enjoyment of the job, which comes to 32% of nurses stated they feel depressed by their administration, and several nurses revealed they had been the target of workplace bullying and harassment. That goes to show that these nurses are leaving these facilities because they do not get the treatment from their administration as the administrators want them to give them. So what I am saying is the nurses are not the only ones that are being affected by this. The patients are being affected by this. As I read in the article in the Lancet, it shows that a nurse that was not able to take her lunch, she was overworked and she couldn't perform her job correctly. She had 2 patients who were diabetics, and she confused the 2 results, giving one of the patients the wrong medication, which led to that patient to go to the ICU. So these nurses working overstaffed and they're getting burnt out, and it's just something that needs to be brought to the attention to other people. It's something that I would like to inform others about, bring from the back burner to the front. I say this to say that let's go back to the person in the emergency room. If you are that person in the emergency room and you go in for shortness of breath, but because you are not having heart complications, you don't be seen. But then what if an hour later you do have that cardiac arrest? This could have been prevented if only they were staffed properly to get you back there and seen, and the medication that you need and observation. That heart attack could have been prevented. So my conclusion is to let you know that the understaffing in hospitals and the not getting you back there is not purposeful. They're honestly trying their best. Thank you.